Hello, everybody. Welcome back to the show. My name is Cameron English, Director of Biosciences at the American Council on Science and Health, joined again by my colleague, Dr. Chuck Dinnerstein, who is our Director of Medicine. Chuck, what's going on? How are you as we approach the 4th of July?
I'm very happy that it's the 4th of July, and I'm looking forward to some festivities. My dog is not, because she does not like fireworks, so I'll be spending some quality time trying to keep her calm.
I saw your that comment that you made in your article recently, and I just laughed because I know that exactly. My dog finds the deepest corner of the farthest bathroom away from where he perceives the fireworks to be,
Mm-hmm.
and
Yes.
just hides, hoping it'll go away. I feel bad for him, but
I do, and I would feel worse for Juno, except Juno likes to share her despair with everybody. So she likes to wander the house and tell everybody she's unhappy.
That's so good, man. Oh, the life of a dog owner. It's an exciting experience. Anyways, we've got two stories we're going to talk about, and they're both nicotine and tobacco related. So the first is a story Chuck wrote called "Let's Talk About Nicotine," having to do with this proposed policy at the FDA to reduce the amount of nicotine in cigarettes. And then we're going to talk about a story I wrote having to do with the FDA's recent ban, or at least proposed ban, on JUUL e-cigarettes. So the interesting ideas here, and they're interrelated in a couple of ways. But Chuck, tell us about this first story. Just give us a rundown. What's the idea behind low nicotine cigarettes?
Well, this has been an idea that's been floating around actually for some time. Who knew? But the Biden administration announced, I guess, last week that they were going to open up for comments next year, because it's never to rush on anything here. The FDA was going to look at the possibility of developing a lower nicotine cigarette for health purposes. So I was kind of interested in the topic, and that's why I took a little bit deeper dive to see what was going on. So first of all, when they talk about lower nicotine cigarettes, they're not talking about those, and this will date me, Virginia Slims and other cigarettes that were advertised as low tar and nicotine in the past, which really just had little vent holes in the filters that reduced the amount of nicotine that way. They're talking about actually developing a lower nicotine tobacco, which would be used as the basis for making cigarettes. And there's really two groups that they're hoping to impact by doing that. One group, and probably the group that they're more concerned about, are the youngins who are thinking about smoking because they're hoping that a low nicotine tobacco will mean that they will not become addicted. So let's kind of look at that group for a moment. So the first problem when you talk about addiction is the fact that there is really no great definition for what constitutes addiction, other than it's disruptive of your social life, and that it may be bad, that it's bad for your health, and you can knowingly continue to do that. But that's not really been established for nicotine as much as it's been established for cigarettes. And there are two different products. Nicotine obviously is within tobacco, and is the chemical within the tobacco that they believe is the addictive component. So first problem is actually how to define addiction, and that remains a little bit ambiguous. The next problem, which is probably the bigger problem, is that there's no known dose of nicotine that is addictive or not. They've never been able to establish how much that is, and that is a scientific problem, and it's compounded by the fact that the dose of nicotine that an individual smoker will inhale is really based on their lung mechanics, how deeply they inhale, and for how long they keep that breath in. That's what determines the actual dosage. So it's very unclear that they're going to actually be able to establish any scientifically based standard for saying this is a non-addictive dose of nicotine. The second group that they want to address with this are people that are already smoking and get them down on a less harmful level of nicotine at what could be described as a maintenance dose. Now, you could probably determine a maintenance dose, and they've done some studies to look at how much nicotine people need. But if you think about people that smoke, you can tell from the number of cigarettes that they smoke during the day what their maintenance level is, and that can vary from people that have smoked 4 or 5 cigarettes a day to a pack a day to more than a pack a day. But the fallacy, the problem, the unintended consequence, which they should recognize right away, is that if you develop a lower nicotine cigarette that people want to have more often for maintenance purposes, then you're only multiplying the number of harmful combustion products that they're inhaling. You reduce the nicotine, which has not been shown to have any horrible health problems, and you wind up increasing the amount of carcinogens that they're exposed to. So I don't think that either reason for developing a low nicotine tobacco makes any sense from a public health or from a science perspective.
So you talk about, let's go back to this idea of an addiction threshold for nicotine. So you write, and you're talking about the studies that have been done on this. It is readily apparent that this is at best an approximation, meaning the way they establish whatever this dose would be. So are we dealing with an example of math magic here? This is a concept you've discussed in many articles to this point. You've talked about it on this, on the show as well. Are we doing sort of like, carry the one, there's 5 unicorns, now there's 7. And like, is that what we're doing with it?
Okay. There's no number that exists in the literature at the moment. And it's doubtful, given how science can measure these things, that we're going to come up with the absolute number. There's still going to be people that whatever the dose is within the tobacco itself is going to be immediately modified by how that cigarette is inhaled. I mean, I'm not a smoker, but I've spent some time with smokers, and they tell me that lighten up and that first cigarette in the morning is great. You take that big inhale and you hang on to it for a few seconds and you let it out and you pour yourself a cup of coffee. So there's no way to determine actually how much nicotine is actually being dosed. So it's never going to be figured out that way. And that brings up another point that I probably should have mentioned, is that there's a large social component to the quote unquote addiction here. There is the having the cigarette with the morning cup of coffee, having a cigarette with the guys or the girls at work on a cigarette break, having a cigarette after work while you're having a beer. All of those social interactions are also part of the addictive behavior. And so how do you address that? That's why I think when you start talking about vaping and a product like JUUL or any of the others, that meets a lot of the social needs that are not going to be met by coming up with a low nicotine tobacco.
Yeah, it's a very good point. I remember I haven't bought a pack of cigarettes in probably a decade now, but I remember when I was smoking, my favorite part of that was waking up early on a Saturday morning when it was cold and foggy outside and pouring myself a giant vat of coffee and whatever book I was reading at the time. And I would just sit on my front porch and I would read and I would chain smoke and I would drink my coffee. And it was just the greatest start of a weekend. I just loved it. It's indescribable how much enjoyment I got out of this. So I can say from experience that is very hard to break. And I think the only reason I was able to do it was because I picked up an electronic cigarette a couple of years later, and it was, I was able to get away from all the harmful stuff. So I think you make a good point there. There's one other thing I wanted to discuss, and there's these conflicting studies. There are quite a few from what I've looked at that seem to suggest that when you cut the amount of nicotine in a cigarette, a lot of smokers will compensate because they're not getting whatever that maintenance dose is that they need. They're not getting that from the low nicotine cigarette. So they smoke, I don't know, it could be 3 more a day, it could be 4 more, whatever it is. So in other words, they're offsetting whatever benefit you're trying to achieve by cutting the nicotine. But in contrast, there's been, I think, at least 3 studies in the last few years that have said, well, there are some smokers who don't compensate in that regard. They don't smoke fewer cigarettes, so that doesn't really do anything, but they're not compensating for the low nicotine dose. So is there just a lot of individual variability in how smokers behave? It seems to me it might be a lot like weight loss, where you have certain diets that work well for some people, for others not so much. Some people may lose more weight on the same diet, and it probably just comes down to your insulin sensitivity or some genetic component that we're not quite aware of yet. Is that what's going on here with this low nicotine?
I think that's the case. I mean, if you looked at people that smoke cigarettes, you'll find an entire range of smoking habits. Not everybody, gets hooked on cigarettes and smokes 3 packs a day. There are people that smoke 3 packs a day. There are people that, as I said, smoke 5 cigarettes a day. There are people that say, I'm only have 3 cigarettes a day. So the threshold for addiction is ambiguous. And as a result, what maintenance level is necessary also becomes unclear. I think we're trying to legislate or regulate an agricultural product without having any of the real pharmacokinetics well understood. And it's compounded by the fact that the delivery system varies from individual to individual and probably varies over the course of the day. And there are people that will have a cigarette, light a cigarette and have a puff, put it down, do some work, and maybe get one more puff out of it. So does that count as its whole cigarette or 2 puffs? I mean, how do you begin to measure any of that?
Yeah, very, very interesting. This is another quote from your story, and this is you summing up the issue and the idea of trying to, I don't know if force is the right word, but maybe sneak these cigarettes into the supply that people have access to. But you write that putting the toothpaste back in the tube is difficult, and we should be wary of solutions that sound good but make uncertain assumptions. And that seems to be basically what's happening. It's like every
absolutely. When the president announces, that we're going to have low nicotine cigarettes to cut down on the addiction to cigarettes, that's a great soundbite, but there is no science behind it, and certainly for this kind of regulation, we'd like some science because they're not going to ban tobacco. Prohibition is not working for a lot of things, and if they wanted to ban tobacco, they could have done that a long time ago. They're just not going to. So these are all various ways to dance around the edges and provide us with the belief that they're making big inroads when in fact they're not doing very much at all.
Don't quote me on this, but I believe both the Master Settlement Agreement from 1998 and the Tobacco Control Act, which is the federal legislation that empowers the FDA to regulate all these tobacco products, I'm pretty sure both of those stipulate that you cannot outlaw tobacco or outlaw cigarettes.
I believe that's the case.
Okay,
yes.
So I think that's why you're seeing these sort of noodling around the edges. We'll change the packaging and we'll whatever the thing is. We'll take out some of the nicotine. They're trying basically everything that they're allowed to do within the law, I think. And
there's another unintended or even intended consequence in this is that every time they bring regulation forward, the lobbyists from both sides get heavily involved. And when the lobbyists get involved, that results in increased election funding to the legislatures that they wish to influence here. So it's part of the same dance. As long as it's not illegal, it's not going to be outlawed, then there will be people that the tobacco lobby will support with financial money. There will be people that the anti-tobacco forces will support with money too. But the politicians walk away with money for their elections, no matter what they decide.
Before we move on, you got me thinking. I remember back in the late 90s when I was still a youngin', I remember seeing a campaign put out by the Truth Initiative and smoking is bad, and these evil corporations are trying to make people sick, this and that. And then at the very end of the commercial, it says funded by Philip Morris. So I remember as a 12-year-old, I was like, what sense does that make? And then now looking back, it's like, oh yeah, this is a classic case of rent seeking. You have the biggest cigarette companies basically massaging the federal laws that restrict access to tobacco because it allows them to maintain their market share to a certain extent. So it's like a compromise between.
Oh, exactly. This went on with medical payments. Every year, Medicare would threaten to reduce physician payments. So every year, the physicians would lobby for more money and give money to various campaigns to support their candidates. And every year the candidates kicked the problem down the road for another 2 years. So it was just every time they brought it up, their coffers filled with money, and they would just put the problem on hold for another year or two. No, this is no different.
Sure. Yeah. It's troubling stuff. I don't know that there's an answer to that except for a more informed populace, but I don't know. That's a topic for another podcast and another day. But what makes your article very interesting, it's interesting in its own right, but I think the context that you wrote it in is illuminating, because the same week the FDA came out and they issued what's called a marketing denial order for JUUL e-cigarette products, like the entire brand. And this got a lot of people excited, and it drove a lot of people nuts because that's the most popular brand in terms of sales. So a lot of ex-smokers rely on these JUUL devices to stay off of cigarettes. And there was no data to look at. The FDA doesn't publish all of the data, as far as I know, that these companies submit. I believe that's all private. But they put out a press release and they said, this is why we're doing this, and we're doing it for the children. It's the typical reason we do anything. It's for the children. But I wrote an article about it because I just found it so utterly unconvincing. And I don't know if this is cynical of me, but I don't think the FDA scientists at the Center for Tobacco Products believe this either. They just can't, because there's just so many things that don't make sense, at least to me. So the first thing is that we have pretty solid evidence at this point. You have both testimonials from ex-smokers, you have clinical trials that have been done, you have epidemiological studies, and they all seem to point to the fact that e-cigarettes and vaping, they're at least and probably more effective in many cases than nicotine gums, nicotine patches, in terms of getting people off of combustible cigarettes. So if I'm a bad guy, I'm an evil villain on the show Captain Planet. If I'm just trying to ruin people's lives, and I want them to keep smoking, what would I do? Well, I would remove the product that helps them stop smoking, right? Yeah. And so now, obviously, I don't think the FDA is intentionally doing that, but the end result seems to be the same. So you're the physician here. What are your thoughts on this overall?
Well, again, I think that nicotine is probably the gateway in both directions. And that if you can provide nicotine in a way that replaces that craving for cigarettes, that's all for the best. And as I talk, when I mentioned that social component, it's hard to have a social component getting up in the morning and chewing a piece of gum with your morning cup of coffee, or popping on your patch. There's no social ability to either of those activities that there are to smoking a cigarette. And that's why vaping, which has a device that you can hold and can look like a cigarette, I think have a better track record in a lot of ways with harm reduction. And I, too, am puzzled by why the FDA would do that. Now, they've approved other brands. So whether they're just going to be giving JUUL a hard time because they're the market leader remains to be seen. And they didn't actually, from my reading of what they said, have any scientific concerns about the product being vaped. It was the product that was being leaked out of the cartridges and combusted at the same time. And So I don't know whether they're going to go with any of this stuff. And as you point out, they're not releasing any of the data, nor is JUUL. So we're all kind of left in the dark on this one.
Right. I'm what I did find afterwards, because there was federal appeals court for the DC circuit the day after this happened, because I think JUUL and their lawyers were ahead of the curve and just being prepared for this, because they've been the villain in this discussion for probably 4 years now at least. But the day after, they filed suit, and they got a circuit court to issue a temporary stay against the FDA order. And the basic argument was, well, you have to at least give them a chance to argue in support of their product and explain what all this evidence that they've gathered for you demonstrates. And what I learned from that is there's 6,000 pages of research, just every possible angle of what the FDA would want to know. So there's clinical data, there's animal carcinogen data, all this stuff. So the court basically said, like, we're going to go through this very carefully and we're going to figure out. So I think there's some good news in that, and it might set a precedent for the rest of the vaping industry in terms of how the FDA is allowed to proceed. So that's potentially some good news. But what I found amusing, and maybe there are other words I would use to describe it off air, but on the one hand, the FDA said, we have some concerns about the inconsistency of the data they put out in terms of genotoxicity, the ability of these products to damage DNA. And then, as you said, the products leaching, presumably that means into the environment, or I'm not quite sure exactly what the context for that is. But in any case, it was funny because we both wrote about a study that was just published about a month ago and that received funding from the FDA that was looking at the possibility that electronic cigarettes boost healthcare costs. And you went through it more surgically, and you said, well, here's, the modeling wasn't terrible, but, the assumptions underneath the study were bad. I think you said overall you gave it a D-. So all that to say, it's funny from my perspective for them to come out and say, we have concerns about the data, and, we just want to make sure this is correct. But on the other hand, they're throwing a lot of money at researchers who are putting out very low grade research. So I find that a little bit, I don't know what the word is. It seems like they're crying crocodile tears here. What do you think?
It's somewhat disingenuous to do that, and it speaks to some of our regulatory problems. We're not giving the regulators clear guidelines as to what we need to be doing in some cases, and they're captured like anybody else. Again, it's I don't think it's any different than the low nicotine cigarette. They came out and said JUUL's off the market, and JUUL turned around, as everyone would expect, and got an injunction. And this will go on for 2 years, but everybody got their headline. And the FDA said, we've taken action, and now, unfortunately, it's in the courts.
Chuck's a cynic. I like it. It's funny. Yeah, it reminds me, I don't know if you've read the book by Christopher Buckley called Thank You for Smoking.
Yes.
Okay. Hilarious book. If you are frustrated by the political climate today, I think you'll find this book amusing, because it's a novel. It's written from the vantage point of a tobacco lobbyist who is sincere in his beliefs, but he hates his job, and he knows what he's doing is kind of slimy, and he puts forward the yuppie Nuremberg defense. I was just trying to pay the mortgage and trying to sell cigarettes to the world. So
that book's like 20 years old at least.
It's I think so. I think it's older than that. It's from the mid 90s. It was turned into a movie in 2005, which is also very, very entertaining. But nonetheless, I think you get to a really good point, which is that everyone has an incentive in this discussion. Everyone claims that it's about public health, but in reality, there are other incentives involved here that no one really likes to talk about, which is, of course, there's money, there's politics, there's a lot of infighting, and there's a lot of overlapping of incentives that are very clearly distorting this discussion. which, and there's not a great way to resolve that. The only thing I can point to is people like me who say very clearly, I started using an electronic cigarette and now I'm healthier. In my case, I can go to the gym, I can lift heavy weights and it's fine. I can go to my doctor and any test they do shows that I'm healthier than I was when I was a smoker. There's just no denying that. There's an organization called the Consumer Advocates for Smoke-Free Alternatives Association, and they have a page that I encourage people to check out. It's just a testimonials page, but there's 1,347 pages of testimonies, and there's 10 per page, so there's over 13,000 people just saying, I was going to die. I couldn't get off cigarettes. I was going to die. I knew I was jeopardizing my health. And then I found this product and it made a difference. So maybe that shouldn't settle the debate, but I think that should be the baseline of our discussion, in that there's clear evidence of benefit here. So if there are other considerations, we don't want kids using nicotine, no matter what the source is. And we don't want people to be dual users. We don't want them to use cigarettes and vape. And there's some other variables that we can discuss, but it seems like we're starting with a conclusion, which is that anything containing nicotine is bad. And so with that conclusion in place, we're going to gather whatever data we need in order to validate that conclusion. What are your thoughts?
Well, I think we get back to the way we approach prohibition on anything. Is once we decided it has to be prohibitive, there's no middle ground. There's no middle way. When we got rid of alcohol, all alcohol was gone. It wasn't, you could have a little wine or a near beer. All alcohol was gone. Same thing when we dealt with the opioids. There's been a struggle. There's still an ongoing struggle talking about various means of harm reduction in the opioid community. And it was a long time before they would accept the idea that you could put people on methadone, another addictive substance, but didn't have any of the associated high with it to use. So I think this is a battle that we've been waging a long time with our Puritan ethos, that it's all or none. There's no middle ground on prohibition. And the reality is, if you really want to move people's behavior, there has to be a lot of middle grounds. Nobody changes overnight. Society certainly doesn't change overnight in terms of things. And that's why these all or none approaches are not going to work.
Yeah, it's a very good point. If I can just put out a short defense of the Puritans, I feel like they have been just so beat up by everybody because the Puritans happily consumed alcohol. You can go back and read even the stodgiest of, whatever, because they were in a lot of ways the Puritans, right? Given the name, but they liked alcohol. They liked sex. They weren't, I don't know. I think the neo-prohibitionists give the Puritans a run for their money in terms of their demands for purity. But nonetheless, I think.
Okay, so I'm going to use the Puritans and that puritanical spirit as the word, but we're really talking about ideologues.
Yeah, sure.
That the reality is the anti-smoking ideologues cannot see any middle ground. For them, it is all or none.
Yeah.
And that, when it comes to public policy and human behavior, just doesn't work. Never has.
Yeah, absolutely. And of course, that doesn't mean you do nothing. That just means you approach the issue with your eyes open and you try to craft policy. You do a risk assessment, which is what we do with drugs and food and any other product. You just say, okay, well, can we achieve the benefits we want while minimizing the potential risks?
And in this particular case, the model we should consider is the UK model, where vaping and these products are considered part of tobacco cessation harm reduction. They're not considered an equivalent product. And they don't have anywhere near the rates of smoking and vaping that we do here in the U.S. Simply because it's framed differently. It's used as a smoking cessation aid.
Right. Yeah, I think in some hospitals, actually, you can purchase electronic cigarettes.
Well, that I don't know. But, we have hospitals that have McDonald's, so all bets are off.
Yeah, I believe it was our former colleague, Dr. Alex Berezow, who pointed that out, that there are some hospitals in England that sell certain e-cigarette devices. And they're not marketed. It's not like, hey, this is super cool, kids. It's like it's a very boring medical device that you can buy, just like you might buy a multivitamin or an allergy pill at the pharmacy or something like that. But in any case, that's good. I think that lays out a good model for us. Well, we're gonna leave it there. Just a quick rundown of these stories. Thank you guys always for joining us. If you want to get these stories in your inbox, you just go to our website. It's acsh.org. Go up to the subscribe tab at the top, punch in your email, and you will get the stories in our dispatch 3 times a week. And then we collect the most popular ones that you guys read, and then we break them down on this podcast. So when you show up, you want to be informed and you have a jump start what we're talking about. That's what you do. But as always, Chuck, thank you so much for joining me. Again, happy 4th of July to you. I feel sorry for your dog already, but I hope it works out okay.
You too, Cameron. Have a good time.
All right, guys. See you next time.